Intelligence Integration Australia. Founder, the late Dr. Moshe Elbaum, PhD, affiliated with Intelligence Integration Israel. Intelligence Integration is a revolutionary training program that improves children's learning and behavioural abilities. It's completely natural and drug-free. It recognises and aims to balance the four main intelligence systems in human beings. It's a result of over 25 years of field research and development, and been developed for the most effective means for achieving goals as quickly as possible. There are three main principles that govern the program. 1. Learning, concentration and behaviour occur as a direct result of how the body does or does not function. 2. The body has the ability to develop the brain's neural networks through physical practice. And 3. Better neural networks, better overall functioning. Intelligence integration is known as the physical foundation of learning because it looks to the body as the primary source of a person's difficulty with learning, concentration and behaviour. When we look to the body, we shift our focus to the inside or core reason behind the child's struggle, as opposed to focusing on outside or symptoms. The method is based on a new training-based approach to improving life quality with a focus on poor neural network function as the primary source of difficulties in learning, concentration and behaviour control. Often learning and concentration difficulties are thought to be directly related to a person's academic capacity. In reality, they represent physical problems in the body's attempt to carry out tasks. When a person's basic neural network is insufficiently formed, the amount of effort needed to perform a task is much greater than it needs to be. What we refer to as poor physical integration, insufficient or undeveloped neural networking causes muscular tension, inadequate flow of breath and other possible side effects such as avoidance, irritability, excitability, impulsiveness and aggression. The majority of these symptoms are associated with attention deficit hyperactive disorder and various other learning, behavioural or emotional disorders. Using the method to develop neural networks can help people who have been diagnosed with these conditions to improve. To function optimally, we need healthy and strong neural network function and clear, uninterrupted communication between the left and right brain hemispheres. In the way that computers rely on electrical signals and wires for optimum functioning, the body relies on electrical signals and wires in the form of neural networks. But where computers need programmers to program new functions, the body can achieve optimum functioning by building its own neural networks. At the most basic level, this is achieved through repetition. Practice and repetition allow for a more efficient biochemical connectivity between those cells that communicate regularly, thereby allowing for faster processing speed. Dendrite growth and the production of new brain cells can be seen as the brain's way of developing muscle and improving overall functionality. The development of new neurons and the growth of a more complex dendrite net that occurs in response to repeated stimuli is why repeated practice of the method's exercises can increase the efficiency of such communication and thus improve overall brain function. The following is a summary of cause and effect given poor physical integration. Insufficient or dysfunctional neural network will bring about insufficient flow of breath during a difficult task. Increase in muscular tension, decrease in oxygen level in the body and the brain, an interruption in thought and concentration, a rise in the level of stress and frustration, difficulty performing, and then ultimately low self-esteem. In some cases, the neural network that is responsible for the control of motor or sensory activity is unformed or insufficiently formed. Learning equals the formation and development of a neural network through practice. Knowledge equals a functional neural network that provides the ability to carry out what has been strengthened, developed, or formed as a result of the learning process. Practice equals development of neural infrastructure equals realization of potential. When a person experiences difficulties in practice, muscular tension will appear, increasing frustration, which accumulates in every muscle that struggles to function, causing excessive effort, causing exhaustion, and then producing an avoidance or outburst of accumulated tension. To understand the functional importance of the motor system, it is important to examine the quantity of nerve activity directed to each system in the motor cortex. Approximately 50% of all activity in the motor cortex is directed to the hands, 25% to the mouth and tongue, 15% to the eyes, and a mere 10% to all other motor function. Insufficient motor control or coordination is usually one of the main factors that causes a child to have trouble modulating their emotions. As long as the child's motor control is not functioning easily and with precision, the body will continue to produce a huge amount of cumulative tension, which then causes a lot of frustration and anger. Following are some of the most common symptoms of learning, concentration, and behavioral difficulties that can occur as a result of a dysfunction in bodily systems. Poor reading comprehension, poor decoding, dyslexia, reading avoidance, hyperactivity, aggression, withdrawal, impulsivity, lack of focus, lack of patience, disorganization, low self-esteem, poor spatial awareness, illegible handwriting, hand and finger fatigue or pain, writing avoidance, behavior, impulse control, poor focus and concentration, poor problem solving or dyscalculia. The tension, anger and frustration generated by a motor or sensory control difficulty must disappear on the level of neurological functioning in order to maintain the healthy condition of the brain and the body. Medications only suppress or mask tension, anger and frustration. They cannot promote neurological development.